Hello. So we're here with Mina, and Mina is 48 years old. And so tell us what you're thinking about the things that concern you, basically.
Well, this under my eyes.
Sure.
And then a little bit of this, which kind of started 2 years ago, I think.
Okay. Yeah.
And then there's a little bit of this.
Okay.
And then the rest, whatever you think.
Okay. So we're describing, somebody who's, I would say is an early adopter. In other words, you could wait, and people obviously tell you look fine. But this isn't something that you're doing for anybody else. You're doing it for yourself. And so,
yes.
We certainly have patients in their late 40s, early 50s who have concerns about aging changes, and we're going to address them surgically because that's the most definitive way to address it. So what we'll do is we'll start with the upper third of the face, and essentially we'll do what's called an endoscopic forehead lift. And what that means is we'll raise the brows slightly centrally and preserve that nice natural arch that she has, and also laterally, just to show off her eyes. We actually have done upper eyelid surgery for Mina
Yes.
in the past.
Came out really good.
Yeah. And then for the lower eyelids, you can see the puffiness here. So this is what I describe as the eyelid cheek junction. And what it is basically the cheek descends downward, okay? And then the fat that surrounds the eyeball, it forms what I would describe as a double bubble, okay? So the idea is to make an incision underneath the lash line and bring this portion of the eyelid upward and inward. That's called a suborbicularis oculi fat pad. We're gonna bring it up a little bit, and then we're gonna shave a little bit of fat down and just create a smoother transition in this area without changing the eyelid shape, because Mina has very nice eyelid shape and we don't necessarily want to change that. And of course, and then the major portion of the procedure will do what's called a deep plane facelift. And so what we'll do is we'll make incisions which will follow the normal hairline, okay, the junction between the ear and the cheek, behind this area we call the tragus, around the ear, and then back into the hairline here, okay? And so the idea is to have incisions that are hard to see, okay? Mina has some heaviness in the lower face here. Early jowling, okay, so the idea is to lift the skin, find the SMAS layer, okay, and then lift the SMAS and the skin together in what's called a deep plane facelift, or a composite lift, basically, raising the cheek and the jawline, okay? We might also remove some buccal fat. You can see sort of some heaviness in this area here, and we can actually access that through the deep plane facelift. Then we have some obliquity in the neck, and this is caused partially by what's called platysmal banding. So the platysma starts here in the lower face, and then it comes down into the neck and the chest, okay? And it's a continuous sheet of muscle and tends to age downward and forward, okay? There's also a little bit of what we call subplatysmal fat in this area here that we'll remove. We'll trim down some muscles that are called the digastric muscles, and then we'll suture or tighten the platysmal muscle, okay? So that will complement or give definition to this area here, in addition to the lift that we're going to get in the lateral face in this area here, okay? And the major thing is to create a balanced look that doesn't change who you are, okay? What we're not going to see, we are going to see improvement in the nasolabial fold, okay? But we're not going to see this wide mouth appearance, okay? Because there's a muscle that surrounds the mouth called the orbicularis oris, and we're not going to pull on that muscle. That's what leads to that weird look, okay? So we'll see improvement, but we're not going to see complete elimination of the nasolabial folds. Now, one thing that could also be done is laser resurfacing, but Mina gets a really nice tan, and she's really type 3, high type 3 skin, and really is at higher risk for hyperpigmentation. So I don't think we're going to do that at this time. Hyperpigmentation means that when you do resurfacing, the melanocytes within the skin get really fired up. They're like batteries that are fully charged, and they want to produce melanin. And patients who have darker skin are more likely to get transient inflammatory hyperpigmentation. In Mina's case, that would be so, and plus you don't have a lot of lines and wrinkles that would really dictate that. So what we're going to do is we're going to highlight the eyes, okay? We're going to, make this area that what people describe as bags less tired, lift the cheek area, contour the jawline, and tighten the neck, okay? And really, we're just going to highlight who she is. That's what facial rejuvenation is about. So we'll do some more videos as we go along, okay? Day of surgery, to after surgery, things of that nature, and show you the progress.
Yeah.
But thanks for doing this video with us.
Thank you.
Okay, great. Thank you. Excellent. We're here with Mina for our preoperative visit, and this is part of the process. The patient will come in 2 weeks ahead of time before surgery, and we'll go through instructions, which my very nice nurse Kelly has already reviewed very, very well.
Yes.
I'm sure very thoroughly, right?
Yes.
And also, you know, the purpose is to see if you have any questions. I know that you're going to tell me you're a little anxious, which is normal, okay? But do you have any questions about the procedure at all, or the procedures that we're going to do?
Well, the only thing that I thought about was it said no, you don't drink or eat anything after 12.
Yes. Yeah.
Does that include water?
No, you can take sips of water.
Okay.
Yeah. The purpose of that is that you don't have sort of heavier food in your stomach.
Okay.
So when you have sedation, you don't want to have a full stomach and you know, basically aspirate.
Oh, okay.
In other words, vomit and then
Yes.
aspirate. And so it's a safety thing.
Okay.
It's pretty routine for surgery. But you can take sips of water.
Water.
I recommend, you know, getting well hydrated the day before.
Mhm.
Okay. So that, you know, you're hydrated, because when you come in the morning. But we will rehydrate you with some IV fluids.
Oh, okay.
Yeah, so not to worry about that.
Okay.
That's a good question, though. So, any other questions that you have? It's not a quiz, but you know.
No, not really. I just asked about the antibiotic.
Yeah.
But I
So-
understand it's preventative.
Yeah.
Yeah. So.
So antibiotic is kind of belt and suspenders. It's not 100% necessary, but it's, you know, we tend to be more on the cautious side.
Okay.
So I'd eat some yogurt in the weeks ahead of the surgery also, and then afterward too. It
Okay.
just helps repopulate your GI tract. But it's a
Yes.
good question also. So
Okay.
good. Any other questions?
No. not
Okay,
really.
very good.
Everything
Okay,
was
well,
very
that's our
good.
pre-op experience, and we'll continue it on the day of surgery. Great. Thank you.